Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about mitral regurgitation. Mitral regurgitation is defined as an abnormal reversal of blood flow from the left ventricle to the left atrium. This is the heart. We have four chambers in the heart, which is right atrium, right ventricle, left atrium, left ventricle. From the left ventricle to the left atrium, the blood flows from here to here. This is known as mitral regurgitation. Etiology. What are the causes for this mitral regurgitations are rheumatic heart fever, mitral valve prolapse, ischemic heart disease, infective endocarditis, myocarditis, dilated cardiomyopathy, congenital and trauma. These are the causes which causes mitral regurgitation. Now you will see the pathophysiology. What happens there exactly in the heart? You will see now pathophysiology. Regurgitation of the blood from the left atrium increases the left atrial pressure. From the left ventricle, the blood goes to the left atrium, so that the left atrium pressure increases and leads to the left atrial dilation. Increase in the left atrial pressure leads to the pulmonary venous congestion and pulmonary edema and pulmonary hypertension. Due to that, the left ventricle congestion, there is pulmonary edema is seen and the pulmonary hypertension is seen. These are the pathophysiology of the mitral regurgitation. The mitral regurgitation is from the left atrium, the blood goes to the left atrium, which increases the left atrial pressure and left atrial dilation takes place. So that there is increase in atrial pressure leads to pulmonary venous congestion. The pulmonary venous present there will get congested, and which leads to pulmonary edema and pulmonary hypertension. Due to the pulmonary hypertension, which leads to the right ventricular hypertrophy and right heart failure. This is the pathophysiology which happens exactly in the mitral regurgitation. Now we will see about the clinical features. Mild regurgitation can be silent for many years. When the regurgitation of the blood goes back to the left atrium is very mild, it can be for many years. But in patient may complain a palpation due to increased stroke volume. Due to the increased stroke volume, due to the blood goes again into the left atrium, due to that the patient may complain palpation. Dyspnea, difficulty in breathing, orthopnea occurs due to the pulmonary edema and left ventricular failure. Due to the pulmonary edema caused there, as I said in the pathophysiology, so the patient feels difficulty in breathing. Patient complains of peripheral edema. The patient has in the legs and hands that gets edematous. This is also a sign of the mitral regurgitation. As well as the clot formation is dilated in the left atrium, leading to the systemic emboli can occur, but less common than the mitral stenosis. There may be clot formation can occur. Patient may present with a fever due to the infective. When the cause is due to the infective, this mitral regurgitation is due to the infective endocarditis, the patient may have fever too. Be irregular and the pulse will be irregular. The signs of the right heart failure, such as the signs of right heart failure can be noted, like JVP, which is increased in jugular venous pressure, peripheral edema, congestive hepatomegaly may be present. These are the clinical features of mitral regurgitation. Now we will see the investigation. How we can find the patient is under the mitral regurgitation. What are the signs? With the signs we should relate to the investigation. The investigation are chest X-ray, cardiomegaly due to the left atrial and left ventricular enlargement. There will be, when we take the chest X-ray, the heart will be so big that it shows there is left atrial as well as left ventricular enlargement. Electrocardiogram, it shows left ventricular hypertrophy and the left atrial enlargement. Echocardiogram, these are the investigation which are done. Complications are atrial fibrillation, systemic embolism, infective endocarditis. It can also lead to this complication. They are atrial fibrillation. I have already uploaded a video on atrial fibrillation. Please to see that also. Systemic embolism, infective endocarditis also I have uploaded. Left ventricular failure, pulmonary hypertension and right ventricular failure. These are the complications. The treatment of this or infective endocarditis prophylaxis. For infective endocarditis, there is a prophylaxis treatment which I have said already in the video. Please do watch it. When the cause is due to this mitral regurgitation cause is due to the infective endocarditis, this infective endocarditis treatment can also be taken. ACE inhibitor reduces the left ventricular volume and the afterload. Diuretics and beta blockers like digoxin is helpful for the treatment for heart failure. Due to the diuretics doubles the urination, which is used in the edema condition, peripheral edemas. Anticoagulant, as I have said, that clot may be also present, so anticoagulants are given. These are the treatment for the mitral regurgitation. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt in it, please do comment it. If you want more videos, please do subscribe. These notes will be given on the Instagram channel. I will just provide the Instagram link. Please do follow that too. Thank you.